Good morning, and thank you for coming. Today marks the 3-year anniversary of Governor Mark Dayton making the first move to fully embrace Obamacare in Minnesota. What seemed like a small $1 million grant just a few years ago has turned into $160 million wasted on a website that still doesn't work. Besides the website, real people across Minnesota are losing their health care plans, plans that they liked, plans that worked for their families. Real people are sharing their stories of higher costs, forced coverage for things they don't need. And these aren't just stories. This healthcare debacle is real, and it's affecting Minnesota families. It affected my family. My sister-in-law, Jessie Collins, is here today to share her story.
Thanks, Michelle. I'm happy to be here today to share our healthcare story. When Obamacare became the law of the land, we were told that families would save $2,500 a year and that if we liked our plans, we could keep our plans. My family, my husband, and our 3 boys liked the healthcare that we had in Minnesota. I'm a stay-at-home mom. We live on a farm in a small rural town in west central Minnesota. We have a tight budget, but we make it work so that I can stay home with the kids. This past October, we received a letter in the mail stating that our insurance rates were set to increase by $870 a year. I called the insurance company, but ultimately they couldn't help us keep the plan that we wanted. Our rates have skyrocketed because the state is forcing us to have dental coverage for our boys. Even Jonathan, our baby, who just got his first tooth 2 weeks ago. Honestly, we haven't even brought our kids to the dentist yet because he hasn't even wanted to see them yet. Before MNsure, we purposely didn't buy dental coverage because it was cheaper for us to just pay cash at the dentist. Now we have to figure out how to pay an extra $870 a year. My husband and I make good choices for our family. We don't need the government telling us what to do. Apparently, Governor Dayton and the Democrats don't trust us to make health care decisions for our family. Well, I don't trust them. We don't trust them. We were lied to. We want our health care back.
And I want to thank Jessie for coming forward to share her story. And I appreciate how far she traveled to share that story with you. But there are many other healthcare stories like hers in Minnesota. I'd like to introduce you to Mark Anderson to share what has happened to his healthcare under Obamacare.
Thank you, Senator Benson. Last year, my family was notified that our health insurance rates would be doubling from $292 a month to over $500 a month for the most basic plan. My wife and I are self-employed as realtors, and now we can't afford to be well or sick. We've been trying to avoid the fines levied by MNsure by making sure we are carrying a valid insurance policy despite those outrageous rates. But we keep running into trouble with billing issues. We're not even sure if we're insured at this moment. When President Obama circumvented the Obamacare law and gave people 1 more year to keep their good insurance plans, Governor Dayton said Minnesota didn't need to do that. He and other Democrats promised that there would be no delays, that the website was going to be functional, and that MNsure was ready to be fully implemented in Minnesota. Well, now we know better. Yesterday, Governor Dayton said that the problems people are experiencing with MNsure are just technical problems with the website. That was a lie. My health care problems are real consequences of a terrible law that took away the health care plan that I chose and was happy with and gave me something worse. That's not fair. The bottom line is I want my health care back.
I'm Senator Karin Housley, and I want to thank you, Mark. Being in the real estate industry, I have heard Mark's story more than once in a week of other realtors and self-employed business owners trying to get health care and worried about it. I'm working with another resident in the St. Croix Valley. I've been communicating with her since the fall when she applied for her family for MNsure, her and her 2 sons, only to find out at the end of December that her and her oldest son were not covered, but her youngest son was. and they said that they had made an error and to reapply. So she reapplied only to find out in the middle of January that now none of them were covered. So they said, we're sorry, we made a mistake, you need to reapply again. And now it's been 4 months, and Mary in the St. Croix Valley still has no idea whether she has health insurance for her family. And this Obamacare and MNsure coming into the state of Minnesota is bigger than just losing your health insurance and having to get reinsured or insurance premiums going up or being forced to switch doctors. It's about taking away our choices in the state of Minnesota. Minnesota was a leader in the country in health care until Obamacare 3 years ago today. According to a Star Tribune poll, 56% of residents in greater Minnesota have said that they are going to be worse off under Obamacare than they were before Obamacare. Governor Dayton recently said that if he could do health care differently, he would, but there was nothing that the legislature could do to fix it. Governor Dayton, I respectfully disagree. With President Obama in town today, we have one simple message. We want our nation-leading health care back. We want Obamacare out of the state of Minnesota. With 5 weeks away from being subject to IRS penalties for not purchasing health insurance, we want our nation-leading health care back in the state of Minnesota. Thank you.
Good morning. I'm Joe Hoppe, the state representative for Chaska and Chanhassen and Victoria. We are looking at a situation where we are, as Senator Housley mentioned, we're looking at potentially Minnesotans that have been trying to get insurance, that have been to the website a number of times, haven't been able to make it work, and now we're about 5 weeks away from the prospect of a potential penalty with the IRS. So what we're hoping that Governor Dayton will today ask President Obama, or maybe Governor Dayton can do it on his own, I'm not sure, but what we'd like to do is push that back and give Minnesotans that are trying to get health care to the end of the year so that they're not going to face a penalty if they've been trying to do the right thing, going to the website and having it not work. We've had a number of occasions where members of the MNsure board have made comments about the gap, the rather significant gap between the number of people that go to the MNsure website and those who actually submit applications. Now, there could be a number of reasons for that, but I think one of the reasons is likely that it's a difficult process. Things aren't 100%. I mean, to be fair, there have been challenges for the exchange for MNsure so far, and they're working through those problems, but people have had issues getting health care. And I think it's reasonable, we think it's reasonable to not have the potential of a federal penalty on the taxes for people that have been trying to get health care. And we would ask again that the governor and the president push this back to the end of the year or a year from now, whatever they want to do, but give Minnesotans more chance to get the health care that the law mandates that they have. I think that's it. Senator, do you have anything to wrap up? Thank you.
And does anyone have any questions?
You mentioned, Senator, that you want your health care back. What policies or how would you change the system, knowing that this is a federal system and obviously a state system?
Well, if you remember, Minnesota had one of the lowest uninsured rates in the nation prior to the implementation of Obamacare. We estimate 9 to 10% of Minnesotans were uninsured. Half of those individuals were already eligible for public programs. That puts us at about 4% of Minnesotans needed insurance coverage of some sort. So instead of a federal sledgehammer, I wish that Mark Dayton, our governor, had defended Minnesota's healthcare system and reached out to Washington and said, let us solve our 4% problem instead of fundamentally transforming what is arguably the best healthcare system in the world. We had coverage for people who were difficult to insure through our MSHA pool. Minnesota Care was stable, bipartisan, working family health insurance. And now that is at serious risk because of the rules that are being put into place in Washington, D.C. We're looking at billion-dollar deficits in Minnesota Care because Washington won't let us run our programs the way we want to run them.
What are you saying is the solution? Knowing what the system is right now.
To let Minnesota run our health care plan. Exemptions have been given to big businesses. Exemptions have been given to special interest groups all over the country. The president, whenever he feels like it, changes the law. He could do that for Minnesota too. he could say, we trust Minnesota to do the right thing. They have proven that they are capable of doing this. And let us manage our healthcare system.
Is there anything you think the legislature could do this session short of a federal exemption like you're envisioning to change MNsure, to make it more effective, or is that sort of a lost cause for you?
Well, if you look at the first 5 amendments that we did on the Senate floor last year, a lot of that would have mitigated the damage. It would have forced transparency. It would have made budgeting more mindful. It would have put the board in a position of having experts on it. So when the insurance companies were coming to me and saying, we don't think this is going to work, we don't think the interlinks are ready, there would have been somebody on the board saying to the executive team, it's not ready, you're missing your deadlines, we need to make some decisions. Those decisions could have been made in July instead of November. We had real solutions in those first 5 amendments. We offered lots of amendments, but in particular, board structure, composition of the board, how the budget was going to be managed, the active purchaser provision. A lot of time was wasted on the active purchaser provision by the executive team. It should have never even been within the realm of possibility for MNsure.
Will Republicans make any efforts to accomplish any of those pieces this session, do you think?
It is unlikely that the Democrats will bring forward legislation that would touch Section 62V, and so it would be hard for us to make those changes if there's not legislation related to MNsure moving forward. Any further questions? If that's everything, I thank you all very much for coming. Have a good morning.
Thank you.